Good morning to one and all. This is Dr. P.S.G. Prakash, professor from the Department of Periodontics, SRM Dental College, Ramapuram campus. This presentation would cover about how to manage dental hypersensitivity. Dental hypersensitivity is one of the most commonest complaints which you can see in older adults. Most of the reasons for dental hypersensitivity could be because of attrition of teeth, erosion, gingival recession. The most commonest complaint or a symptom which the patient reveals is hypersensitivity for hot and cold. So this is most of the times addressed with desensitizing agents and desensitizing mouthwashes. But do they give you a complete remedy for these hypersensitivity issues? No, usually they don't. So the laser, which we usually practice in our dentistry, about low-level laser therapy, which usually is prescribed for pain management and biostimulation, this helps us to even work on hypersensitivity and address it for a longer period of time. So the hypersensitivity management can be addressed by two ways using a laser. One is with the medication and other is without a topical medication. So the use of laser is usually with low power settings, 0.5 to 1 watt settings, with exposure of 15 to 120 seconds, with an interval of every 30 seconds, where you can have a 8 seconds break. So usually we use it in a non-contact mode, and we try using it along with the desensitizing toothpaste on a tooth structure or without that. The most important thing about how this desensitizing agent along with the low level laser helps to reduce sensitivity for a longer duration of time. Studies have said that it works for more than 6 months to 1 year, where multiple sittings can really help for a longer relief. The application of this desensitizing toothpaste on the root surface helps us to block the dental tubules, and the application of this low level laser therapy helps to chelate these topical dentifrice or the desensitizing agent which you applied onto the root surface exposed dental tubules, and it blocks the dental tubules. The application of low level laser therapy along with and without a desensitizing agent helps to chelate the dental tubules or the topical agent which we have applied, and this helps us to block the dental tubules from spreading the sensitivity issues. Low-level laser therapy of dental tubules helps us to give a long-lasting relief. How do they do this? They primarily help in the sealing of the dental tubules and by disrupting the nerve endings. So the use of this topical paste along with low-level laser therapy can really give a long-term benefit and treatment for hypersensitivity management. We have seen the theoretical part of it, so now we will go into the hands-on of how to apply these low-level laser therapy in the management of hypersensitivity. Dental hypersensitivity. We will show you about the most commonest lasers which you are using in dental practice, which is your diode. So either you can apply a desensitizing agent or a direct exposure of your laser tip onto your root surface. The amount of settings which you try to keep for desensitizing of your tooth structure is 1 watt, 0.5 to 1 watts, which comes with a non-contact mode, and you will irradiate it for 1 to 2 minutes. usually 30 seconds to 120 seconds. That's what is a normal thing which we try to do. So the key principle is non-initiated tip. It should not be initiated. The tip should not be initiated. It should not have any initiation. It should be in a non-contact mode. It should be in a non-contact mode. So what does this do is, when you keep it in a non-contact mode and when you do your hypersensitivity management with the diode laser, this carbonizes your root surface and seals your dentinal tubules. So this is how your laser directly works on the root surface. The other method of using this is, I'll just show you. Just apply a layer of desensitizing toothpaste onto the root surface which is exposed. Just apply it onto the root surface and you try to show your laser, which is the settings of 0.5 watts, which is low level laser setting, and you try to keep it with a distance of 1 to 2, usually 1 to 2 millimeters or 3 to 5 millimeters, and then you try to initiate it with a longitudinal way with a sweeping motion all around this root surface. So usually you keep it for 30 seconds continuous wavelength, 30 seconds continuous exposure with a 30-second exposure at one point of time, and this repeats for 2 to 3 times, that is up till 120 seconds. So what does this do is, this laser chelates your desensitizing material and occludes your dentinal tubules. This is one more way of doing it. So there are two ways of doing laser management for hypersensitivity. One is use of a desensitizing toothpaste and then exposing the laser 0.5 watts, which is a low level laser, non-initiated tip, non-contact mode with a continuous power setting, exposing it from 30 seconds to 1 minute time per site. That is either your buccal site or your palatal site. One is the way is you directly use this onto your root surface, moving up and down in a sweeping motion and with a continuous power setting onto the root surface. This helps us to occlude or seal or carbonize the dentinal tubules and seal them off by solving your hypersensitivity issue. That is one way of doing it. The other way is to apply your desensitizing agent onto the exposed root surface and then you expose your laser onto this exposed root surface for in a continuous wave for 30 seconds at one exposure and then a gap and again a 30 seconds till 1 minute exposure. This helps to seal your dentinal tubules, occlude your dentinal tubules with the help of this chelating agent or the desensitizing material. Simplest way of treating hypersensitivity. Always make sure when you are using a laser, you have a low level laser therapy setting, continuous exposure, along with to make sure that you have a non-contact mode. You should never touch the root surface with a diode tip. So these are all the things which you should keep in mind when you are treating about a hypersensitivity patient. Thank you so much for your patient listening.